So the Mini-Cog test is a version of a screening test to ascertain whether someone is at risk for dementia. So there are other additional tests like the Mini Mental Status exam, like the SLUMS or the St. Louis Mental Status exams that we do perform. The Mini-Cog has the advantages of being relatively quick to perform, anywhere from 3 to 5 minutes. It is something that a trained individual can actually perform with ease and provide results for a client to either be referred or to provide some type of reassurance for their cognitive health. And those two components, you're looking at memory as one of the components. The other component, in terms of visual spatial recognition, is the ability to really appreciate the intake of messages within the brain and to process them and apply them on paper. So if that is for lack of a better word, broken, we want to make sure that, again, that is better appreciated with some additional testing. So, what brings you in today?
Well, I got this phone call saying that they wanted to do some testing, and I've always been asking you about, dementia with the old Indian people. So I got interested in it. That's why I asked you to give us a test when we had our elders meeting that one time. I was pretty interested in it because a lot of Indian people don't talk a lot, so that's why. But I came in to have it done, and if I have problems, at least I'll know.
Good. I'm glad you came in today. So once the Mini-Cog is provided and scored for a client, it provides a good platform to delve into what issues may lie behind the scoring. So if the Mini-Cog is scored low, or if it is scored low, then we definitely want to do some additional questioning, some asking about some potential exposures, whether there's some additional information that would categorize them or predispose the patient to other diseases, alcohol or vitamin deficiencies or vascular insults within the brain, and that would require some additional testing outside. If it's normal, then we can provide some reassurance that aging and the normal cognitive deficits are part of that process, and they may consider some additional social supports within their family or the community to make their lives more productive and safer. So the ability for the Mini-Cog to be so versatile and to allow it to have minimal amount of training in order to implement has allowed it to not only be placed within the attempts at screening in the community, but also in the medical department during exams, and also at community events, but more importantly in integrating a lot of our other components of medical care, which includes the dental department. By allowing patients to be evaluated within those other departments has really facilitated a larger screening process to gather more patients who may be at risk for dementia.